Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Snoring. Introduction.
Snoring happens when tissues in the neck and throat vibrate as air moves past them.
Snoring can be an annoyance for your partner or other people living with you. Sometimes snoring may be a sign of a serious health condition. This program helps you understand snoring. It includes information about the symptoms, causes, risk factors, diagnosis, and treatment of snoring. Snoring.
Snoring is the sound made when air strikes tissue in the throat as you breathe out during sleep. Almost half of all adults snore at least some of the time.
As you breathe, air passes in and out of your lungs through your mouth, nose, and throat. Your throat muscles may relax as you sleep. This causes tissue to dangle or collapse in the throat, partially blocking the airway.
Snoring happens when air strikes relaxed tissue in the neck as it leaves the lungs.
Snoring can be an annoyance for your partner or other people living with you. Sometimes snoring may be a sign of a serious health condition. Snoring can also prevent you from getting enough quality sleep. This can result in being tired during the daytime, problems in your relationships, trouble concentrating.
Depending on the cause, people who snore may also be at a greater risk for high blood pressure, heart failure, and stroke. Snoring can also make car accidents more likely if the person did not get enough sleep.
Children who snore may also be at risk for behavioral problems. This is especially true if the cause of snoring is obstructive sleep apnea. Children who snore take in less oxygen during sleep time. Less oxygen to the brain may result in hyperactivity, inattention, and poor impulse control. Symptoms. The symptoms of snoring depend on what is causing you to snore. This section includes some of the most common symptoms of snoring. People who snore may experience the following symptoms at night: shortness of breath when trying to sleep, restless sleep, or tossing and turning. Snoring can also cause daytime symptoms, including difficulty concentrating on a task, feeling tired or weary, high blood pressure, irregular heartbeats, sore throat. Half of all adults snore at least some of the time. You should see a healthcare provider about your snoring if you wake up choking or gasping for air. This may suggest that your snoring is part of a more serious condition.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes. There are many factors that can lead to snoring. This section provides information about some of the conditions that affect the airway and cause people to snore.
The structure of your mouth can cause you to snore. Some people have thick tissue or tissue that hangs lower near the back of their mouth. This may cause the airway to be smaller, which can cause snoring.
Enlarged tonsils or tissues in the back of your throat known as adenoids may also cause a narrower airway. An elongated uvula, which is the flap of tissue that hangs down at the back of your mouth, can also block part of the airway. Both of these can cause snoring. Snoring may also be caused by your physical health. Being overweight may cause people to snore. The extra weight can build up in the throat and cause the airway to become narrower.
Snoring may also be caused by problems with the nose. A deviated nasal septum, which is a crooked dividing wall in the middle narrow part of the nose, may cause you to snore. Ongoing nasal congestion could also result in snoring. Drinking alcohol may cause snoring. Drinking too much alcohol at night can loosen up the muscles in the throat. This makes it harder to control airflow.
Snoring may also have a more serious cause. Obstructive sleep apnea. This is a serious condition in which throat tissues obstruct the airway and prevent breathing. Sleep apnea often involves episodes of loud snoring followed by periods of silence when your breathing stops or almost stops. Sleep apnea does not always cause you to stop breathing, but it may cause your airway to become so narrow that you do not get enough oxygen. If your body doesn't get enough oxygen, it signals you to wake up by forcing your airway to open. This usually results in a loud gasping sound. If you believe that you have obstructive sleep apnea, talk to your healthcare provider about your symptoms. A sleep study is usually required to diagnose sleep apnea. Diagnosis. When you see a healthcare provider about your snoring, he or she will perform a physical examination and take your medical history.
Your partner may need to answer some questions related to what the snoring sounds like and what time of night you snore. This helps the healthcare provider figure out how much of a problem your snoring is.
Your healthcare provider may request an imaging test to check your airway for problems. An imaging test could be an X-ray, a CT scan, or an MRI.
You may need to complete a sleep study. A sleep study usually requires you to spend the night at a sleep center. During your stay, your sleeping habits will receive an in-depth analysis from a team of specialists. During a sleep study, sensors are placed on your head and other parts of your body. These sensors allow the team of specialists to record information about your body and brain while you sleep, such as heart rate.
Risk factors. Certain factors increase the chances that a person will snore. These are known as risk factors. The following section lists the risk factors associated with snoring. Certain problems of the nose, mouth, or throat could increase your risk of snoring. These problems include an elongated and enlarged soft palate, deviated septum, enlarged tonsils or adenoids, narrow airway, ongoing nasal stuffiness or congestion.
Certain lifestyle choices and health issues can increase your risk of snoring, including being overweight or obese, drinking alcohol late at night, sleeping on your back. Men tend to snore and have obstructive sleep apnea more often than women.
Treatment. Snoring is usually first treated by making changes to your lifestyle. Your healthcare provider may suggest that you lose weight, stop drinking alcohol before bedtime, or change your sleeping position. Your healthcare provider may suggest other treatments if lifestyle changes do not stop you from snoring.
Your healthcare provider may suggest using an oral appliance. This is a mouthpiece that keeps your airway open by adjusting the position of your jaw. You will need to see a dentist to be fitted for the device. A continuous positive airway pressure machine, or CPAP, may be needed to treat your snoring. This treatment requires you to wear a pressurized mask over your mouth or nose whenever you sleep. Attached to the mask is a small pump that forces air into your airway. A CPAP machine will help you stop snoring. It also prevents sleep apnea. It is the preferred method of treating sleep apnea because it is very effective. However, the CPAP may not feel comfortable, and the noise bothers some people.
Palatal implants are another treatment used for snoring. This procedure involves injecting braided strands of polyester filament into your soft palate. This causes your soft palate to stiffen, which reduces snoring. There are no known side effects from palatal implants, but the strands will occasionally come out on their own.
Your healthcare provider might recommend a surgical procedure known as a uvulopalatopharyngoplasty, or UPPP. During a UPPP, your surgeon removes extra tissue that is partially blocking the airway. Radiofrequency tissue ablation, or somnoplasty, is another treatment method for snoring. During this procedure, a surgeon takes out part of your soft palate to ease your snoring.
Preventing snoring. There are some ways to prevent or quiet your snoring without seeking medical attention. The following section includes some lifestyle changes that may help prevent snoring.
Sleeping on your back can cause your tongue to fall and block your throat. A natural way to ease your snoring is to sleep on your side. This allows your airway to stay open and prevent you from snoring.
Another way to prevent your tongue from falling backward into your throat during sleep is to raise your bed. You might try raising the head of your bed by 4 inches using wood blocks or some other sturdy material. If you are overweight, losing weight may help decrease snoring. Being overweight causes snoring because your throat has extra bulkiness that narrows your airway.
Nasal strips can help reduce your snoring. These strips can open the nasal passageway. They are only effective in treating snoring and will not help with sleep apnea.
Limiting alcohol or sedatives can also decrease your snoring. You should not drink alcohol for at least 2 hours before going to bed. Alcohol and sedatives cause your muscles to relax, which may cause the tissue in your throat to become more obstructive. If you have nasal congestion or an obstruction, you might be able to prevent snoring by treating these conditions. Congestion may be treated with medication. A deviated septum or other obstruction may be corrected with surgery. Talk to your healthcare provider about treatment options for these and other problems.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary.
Snoring is the sound made when air strikes tissue in the throat as you breathe out during sleep. Almost half of all adults snore at least some of the time.
Certain lifestyle changes can help you stop snoring. Your healthcare provider may suggest that you lose weight, stop drinking alcohol before bedtime, or change your sleeping position.
There are some devices, such as oral appliances, CPAP machines, and nasal strips. Surgery may be needed in more severe cases. You should see a healthcare provider about your snoring if you wake up choking or gasping for air. This may suggest that your snoring is part of a more serious condition.
If snoring causes you or your partner to lose sleep, talk to a healthcare provider. You may be able to decrease your snoring or stop snoring altogether. A good night's sleep is possible.
Thank you for using Explain.